we were dispatched to a 24-year-old male who was walking on the curb. He got hit by a car. He is currently sitting on the curb holding his ankle in pain.
Okay, donning my PPE. Is my scene safe?
Your scene is safe.
Got one patient.
One patient.
Mechanism of injury is vehicle
Hit
versus
by a car.
pedestrian. I will consider C-spine and I will call for ALS backup,
Yes, sir.
just to be safe.
Okay.
Okay. So, excuse me, sir. My name is Ignacio. I'm with the EMT program here at Hartnell. What's your name?
John.
Do you know what year it is?
23, I believe.
Do you know who the President of the United States is?
Joe Biden.
And do you know where you're at?
In the street.
Okay. So what seems to be the problem today? What's going on?
A car hit me, man.
Do you have pain in any specific area?
My ankle per se. Bitch.
Your ankle? Okay. Is the ankle bleeding profusely or is it just...
No bleeding in the ankle.
Okay. So I'm gonna go through my full ABCs then, make sure he has patent airway.
He does.
His breathing, is his respiration?
He's breathing a little shallow.
A little shallow? At what rate?
He's breathing at 16 breaths per minute.
16 breaths per minute. Okay, and do I have bleeding anywhere else in the body?
No bleeding.
Okay. Do I have any visible life threats?
No visible life threats.
Okay, so the first one I'm going to attempt to gather my sample history.
Okay.
Signs and symptoms, obviously, you know, he was hit by a vehicle, but the only sign and symptom that we have right now is pain to the, is it right ankle or left ankle?
Right ankle.
To the right ankle. Are you allergic to any medications or anything?
Penicillin.
Penicillin. Are you on any medications?
Antidepressants.
Antidepressants. Okay, and do you have any pertinent medical history I should know about?
No, man.
When's the last time you ate something?
I ate a cheeseburger like an hour ago.
Okay. And what were you doing before this happened?
I was just walking on the street, man. This car hit me.
Walking down the street, the car hit you. Okay. So I would have my partner actually administer oxygen therapy since his breathing is shallow and a little bit elevated. It'd be, at this point, it'd be a nasal cannula at 6 liters per minute. And since he is complaining of his ankle, I would go ahead and splint that, being sure to check my CSM and pedal pulse as well. And after that, I'd move on to my secondary assessment, doing a full head to toe, checking for decap BTLS.
What does decap BTLS stand for?
Deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations and swelling.
Okay.
So full on physical checking. I also check the pupils, make sure everything is pearl, nothing's off there.
They're pearl, and there's no major bleeding on the head.
There's no fluids leaking from his nose or ears.
No fluids that we can see, no.
No GVD or tracheal deviation.
Nope. He has midline trachea.
Collarbones.
Collarbones intact.
Palpate the chest and 4 quadrants of the stomach.
He has he has pain on the right quadrant of the stomach.
The right quadrant of the stomach? Okay.
All we see is bruising. Nothing, no apparent life threats on the stomach.
Okay. I'm also check, make sure the
Pelvis is stable.
pelvis is stable. Good. Check my legs as well. Femur's fine. Check the other leg as well. Except wouldn't be putting any pressure on the ankle since I
Once you
already
get your
had it
ankle, it hurts.
splinted. Do the same with the upper extremities. It's all fine. And then I'd have to roll him over, make sure that I could check the back of his head, neck, and spine as well.
Okay.
Here. And then the buttocks as well.
Spine isn't compromised.
At this point, just due to the nature of injury, I would transport him to the Natividad for trauma center.
Okay.
Code 3 because of the mechanism of injury, and make sure that I also monitor him every 5 minutes, give him a blanket as well, just to make sure that he doesn't go into shock or anything, especially because he has that one thing on his stomach and a possible broken ankle.
See?